Sex-based differences in biology influence how the body responds to fat accumulation, and one area where these differences are increasingly evident is in autophagy. Autophagy, the cellular process of recycling damaged organelles and macromolecules, is sensitive to hormonal signals and metabolic stressors, both of which are shaped differently in males and females. Emerging research suggests that men and women may activate autophagic pathways differently in response to obesity, with implications for fat distribution, inflammation, and overall treatment outcomes. These variations may help explain why obesity tends to manifest in different ways across sexes, and why some interventions are more effective in one group than the other. In females, estrogen appears to play a protective role by modulating autophagy more efficiently under metabolic stress. Estrogen interacts with signaling pathways such as AMPK and SIRT1, both of which are known activators of autophagy. This hormonal influence may help women maintain better mitochondrial quality, reduce oxidative damage, and preserve insulin sensitivity, especially in premenopausal years. As a result, autophagy in female tissues such as liver, adipose, and muscle may be more readily activated in response to intermittent fasting, exercise, or caloric restriction. This might partially explain why some women respond more favorably to lifestyle-based interventions for obesity, particularly when those interventions are designed to cyclically stimulate energy stress. In males, autophagic responses may be less robust under the same metabolic conditions. Testosterone does not appear to support autophagy activation to the same degree as estrogen, and high-fat diets have been shown to suppress autophagic activity more dramatically in male animals than in females. Additionally, men tend to accumulate more visceral fat, a depot that is metabolically active but highly prone to inflammation and mitochondrial dysfunction. When autophagy is insufficient in visceral fat, the result is increased oxidative stress, immune cell infiltration, and insulin resistance. These differences may contribute to the higher risk of metabolic syndrome, fatty liver, and cardiovascular disease observed in obese men compared to women of similar BMI. There are also sex-specific differences in how the hypothalamus and peripheral tissues signal energy imbalance and respond to nutrient excess. For instance, some animal studies indicate that hypothalamic autophagy is more tightly regulated in females, helping maintain more stable appetite signaling and energy expenditure under metabolic challenge. In males, impaired hypothalamic autophagy may contribute more directly to leptin resistance and disrupted satiety feedback, increasing susceptibility to overeating and weight gain. Encouragingly, these differences are not barriers. They are clues that can help tailor interventions more precisely. For example, women may benefit more from strategies that capitalize on rhythmic autophagy activation, such as time-restricted eating or moderate endurance exercise, especially before menopause. Men may require more targeted support to overcome greater autophagic suppression, potentially involving higher intensity exercise, specific nutrients like polyphenol or omega-3s, or pharmacological agents that boost autophagic signaling. Hormonal status, including menopause or testosterone deficiency, can also affect autophagic tone and should be factored into any long-term weight management strategy. What this highlights is the value of personalized medicine. Autophagy is not a one-size-fits-all mechanism, and understanding the interplay between sex hormones, cellular stress responses, and fat distribution patterns can lead to more effective and sustainable treatments for obesity. It also emphasizes the importance of including both sexes in clinical trials, as many early studies on autophagy were conducted primarily in male animals or humans, leaving gaps in our knowledge about female-specific responses. Ultimately, recognizing the sex-specific dynamics of autophagy in obesity shifts the narrative away from generic advice and toward more nuanced, biology-informed care. Whether through lifestyle interventions or future therapeutic compounds that modulate autophagy, aligning strategies with an individual's hormonal and metabolic profile may unlock better outcomes and reduce the long-term burden of obesity-related disease for both men and women.